welcome to another session of Ask Dr. Leila podcast, where we delve into different dental issues and topics. And today's topic is really amazing. I think it's a hot topic right now. It's about sleep apnea. And we have Dr. Gayatri Mago with us again here to discuss further about how dentists can help patients with sleep apnea.
Correct. Thank you for having me once again. I think it's been a while and I was kind of missing being here. So, thank you. Yeah, I think we do play a significant role in helping alleviate some symptoms of sleep apnea and, possibly being points of contacts to further refer these patients, down to the specialists they need to see or, for sleep studies where we would have a specific diagnosis of sleep apnea. If you don't mind, I'd just like to elaborate on what it actually is or
If we can
what.
define it, absolutely, for
Yeah,
everybody.
yes.
Yes.
So basically, sleep apnea or obstructive sleep apnea is a condition where there is possibly a physical obstruction in the airway, and that obstruction causes the airway to collapse. So when you're sleeping and you're not wide awake, all of your muscles relax, right? So the muscles of your airway relax too, and sometimes a lot, and then they do not let the airway remain patent at night. And when it's complicated with an adenoid hypertrophy, which are glands in your neck, or a tonsil enlargement, it gets further complicated. So the patients may experience that, they're snoring or they wake up frequently gasping for air at night, and they can just have repeated episodes where, they shuffle in and out of sleep. So when they wake up in the morning, they can feel excessively tired. They could experience a lot of daytime sleepiness, and it becomes a very big hazard for their overall health. And it's also a risk factor, if they were in jobs like ours or if even they were driving a car, because if you sleep behind the wheel, that's
That's
not
it.
good news for anybody.
Very true.
So even though we think about it as a multifactorial lifestyle disease, the impact for patients suffering can
It's
be,
huge.
yes, extremely, extremely
Mm,
huge.
and for their loved ones,
And
I
for
must
their
say.
loved ones.
So,
Yes.
as an orthodontist, how do you approach patients with either mouth breathing or sleep apnea?
So it's like important to evaluate where the mouth breathing is stemming from. Some of the causes, particularly in children, can be the same. It could be because of, again, adenoid hypertrophy, tonsillar enlargements, frequent infections of the throat. It could be because of allergies. So either the mucus that
So,
is,
identifying,
yes,
yes.
it's
But what
extremely
do you see
important.
first on the chair? Like,
So, on the chair, we could see it's a very typical mouth breathing face. It's a longer face with sunken eyes, shallow cheekbones. The mouth will be slightly open. There's a little bit of, dryness of the lips. And if you look a little deeper, then the gums in the incisor teeth appear slightly swollen and a
correct.
little more reddish. And you can hear them,
Exactly.
that
Yes.
heavy breathing sound
Yes.
or maybe a wheeze that's very, very evident. And sometimes they can look a little tired or disconnected from their environment. They could have a slightly head low posture, which makes it easier to breathe from the mouth. So these are the things. It's pretty
I'm sure
easy.
these patients keep wanting you to give them breaks,
Yes,
either while you're doing scanning or placing brackets.
yes,
Yeah.
or suddenly there's this gasp of air they let out, and you understand yourself that, because they're really, all of our patients, they're always trying to be nice in their own way. They're trying
To
to
help
help
us.
us,
Yeah.
So suddenly when they gasp out that air, you can tell that, they rely heavily on their mouths for breathing. Because if you
Absolutely.
have a nasal breathing constantly, then when we work in their mouth, we don't tamper with anything,
True.
right?
Very true.
So the signs are very easy to identify and pick out. And then I think the first thing to do is to do a comprehensive examination to look for dental factors that can stem from this. So, the most important factor for us where we at once start treating is to have a narrow upper jaw and to have a cross bite, wherein the upper jaw at the back on one side or both sides bites inside the lower jaw. So, this is 100% an indication to start treatment. And the most common form of treatment we offer is an expander.
Expansion.
Yeah, so that sits at the palate and it widens the oral airway slightly and reduces the resistance that you feel when you're breathing. So, this could help out. In other circumstances, when it's obviously missing, it's best to refer the patient to an ENT
ENT.
so that they can investigate further, isolate a cause for what's causing that mouth breathing, and sometimes knowing the cause is better because when there are short term infections and you breathe from the mouth, when you recover from the infection, the mouth breathing goes away. But if it is constant and consistent, then you even become habituated to breathing from your mouth
Correct.
even without an obstruction. So it's important to identify the cause, keep it under control as much as possible so that these long term, lifelong habits don't develop.
Thank
Right?
you so much. I think you touched upon how the misalignment as well and sleep orders disorders are related.
True.
And you, yeah,
So, if this continues throughout the night and you're breathing from your mouth, you are snoring, you are not getting that satisfaction of breathing, so you gasp and you wake up frequently, this needs to be again evaluated.
correct.
So, you need to look a little deeper. So, now mouth breathing could just be a manifestation of something deeper, which is obstructive sleep apnea. So we're so lucky that there are specific diagnostic tests to, diagnose a patient with sleep apnea. And one of these tests is, we've all heard of it, to go to a sleep clinic and let
Correct.
them do
Do
a
a sleep
sleep
study.
study
Yeah.
on you. And there are certain factors that people look at in the sleep study. One is how many episodes of this lack of breathing did you have? They monitor your oxygen levels, they monitor your carbon dioxide levels. So it's a pretty comprehensive exam, to see not just the presence or absence of, but also the severity or the extent of sleep apnea that an individual might be suffering from.
And in fact, I wanted to stop you there because not only are you an orthodontist, but you're a psychologist, Dr. Mago.
Yes.
And as a psychologist, how would you say it has affected people's wellness
So,
and mental health? As that's also something that's super important these days.
absolutely. You know what? We often overlook mental health, and just like every other sector of medicine, any long term illness and the impact on mental health is very overlooked. But this is such a big impact because when you have sleep apnea, you're not sleeping, you have fragmented sleep, so you're irritable, you don't feel fresh the next day, you have difficulties focusing on things in your everyday life. Your memory becomes a little fuzzy because when you sleep at night, the memory pathways consolidate and your memory is transferred to long term memory. You can have a learning disorder because you can't concentrate, you can't focus. So, you could be
So I can
forced.
say, sorry, a lot of misdiagnosis actually happens because as I delve more into this topic, I know that um, some women get put on, some sort of medication saying that, you've reached menopause and now, you need the happy pill or you have depression. And it's all because the link, it was
They're
not
not
there.
sleeping properly.
Right.
So
Yeah.
sometimes, as medical practitioners, whether we are pressed for time or preoccupied ourselves, we don't listen sometimes to what the patient is telling
Which
us.
is
I
very
mean,
important to do.
absolutely. So the history can give you so much. It's one additional simple question and it can make a world of a difference, right? In fact, you mentioned women, but even children. If your child is not focusing at school, if they can't catch up what is being taught as much as the next child, they can be falsely diagnosed as having ADHD.
Correct.
And then it becomes a label, and then there's social stigma with that label.
Correct.
Correct?
Correct.
And I think one more thing when it comes to snoring, even if it's not associated with sleep apnea, it plays on your self esteem. You don't
Yes,
feel as confident. You kind
100%.
of become introverted because you want to be in your own space. You don't want
Absolutely.
people to know. And you know the
You don't want to
impacts
be in
of.
relationships, I would imagine, right?
Absolutely. And it's
Yeah.
important because we all need to have people who support us. We
Companions,
all,
yeah.
yeah. So, I mean, low self esteem again is related to anxiety, to depression, to so many psychological disorders. But I can't emphasize the importance of sleep itself to function appropriately, cognitively, to be able to run in the
It's
rat
huge now.
race.
Remember
Yes,
years ago, I'm much older than you, but I remember they used to say, "Oh, we when we die, we sleep." But no, if we don't get, and for all of us, it's not 8 hours. For some, could be seven, but in that area, if we don't get it, we're actually not functioning. And I know
exactly.
still, I mean, now less. There was a time where people used to brag, "Oh, I got through the day with 4 hours of sleep." Well, I don't think this is something to brag about anymore because really you're not at your full capacity. And
If you
that's
haven't
so
slept.
important now.
And it's the
That's why we're all wearing
quality.
these watches. And I advise, this is just a side note, and I have no association with any of them, no stocks, nothing. But this does really help to know that we're getting
Quality of the sleep as well.
absolutely.
So, I mean, not sleeping or being able to fall asleep easily is one thing, but having fragmented sleep, even if you lay in bed for 7 hours, you wake up the next morning and you tell people I slept for a
And
good
that's
7.
exactly what we're talking about today is the
Exactly.
fragmented sleep.
It's the fragmented sleep, and
Right.
it can have such impacts even on children right from the beginning versus on adults as well. And I did mention how risky it is if you're operating machines every day for your professional needs, if you're
Correct.
driving.
Correct.
It's very important and
It's
it can't
huge.
be emphasized enough. So anything interfering with that needs to be looked into.
Absolutely. And what can parents look into with their children? Now I tell them, send a little video because I've learned that this is important, but for us to look at. But how could parents diagnose this at home?
They can look for signs like snoring, which is, an obvious sign. They can look at, excessive, very heavy breathing. They can look at a dry mouth, exceptionally dry mouth at night. Sometimes kids can sleep in weird positions where it can make it easier for them to
Don't they
breathe.
move more
They
in their
move,
sleep? Yeah.
absolutely. They can have unusual or more frequent
And there's
movements.
a special sleep position as well that
Exactly.
it
So they
brings
may
on. Yeah.
sleep sideways or,
Yeah.
on their backs and not want to sleep on their stomachs, just to have the airway clear. And sometimes it could extend all the way up to bedwetting. So this could be a new sign if your child is not wetting the bed. Plus, if you couldn't check in on them at night, then when they wake up, they're irritable, they have behavior problems, they're not able to focus on things happening around. So, all of it together, can be like a hint, and it sometimes could be nothing, but it's never too harmful to be too careful.
Absolutely. So for parents out there, I think they should bring this up to their dentists, attention. I know we see dentists hopefully every 6 months in our lives. So this is a key person. But for you, Dr. Mago, who do you like to collaborate with as other specialists,
So,
whether it's in the dental clinic itself and outside?
yes. So I would like to say that if it is a diagnosed case and we have, the results from the sleep study, and if the patient falls into a category of mild to moderate, orthodontists or prosthodontists or anybody trained in sleep medicine as a dentist could be a go to person to fabricate these oral appliances that people can wear when they sleep
Correct.
at night. So, usually, the principle of the oral appliance is that it's a two-part appliance. A part of the appliance attaches to the upper jaw, and the other part attaches
To
to
the
the
lower,
lower jaw.
yes.
And when you bring the two parts together, it forces you to bite forward, right?
Correct.
So, when
Yes.
you bite forward, your tongue moves forward,
Mm-hmm.
and the overall volume of the airway increases.
Increases, opening the space.
Yes,
Yes.
and it prevents the tongue from falling back. Right now, luckily, these appliances have shown promising results in a few percentage of the cases, they've shown quite a bit of reversal of the symptoms and even a reduction on the sleep study scores. And in most of the patients, if they fall in the mild to moderate category, there can be a reduction of at least 50% of symptoms and severity of sleep apnea,
Which is huge.
which
It's
is a
great.
significant difference.
Exactly.
But the only issue here might be the compliance, because a lot of people are not used to sleeping with bulky structures in the mouth. It might take a little getting used to. There can be some starting trouble. And with starting trouble, some people are good and committed and have higher thresholds for that. And some people, like me, may want to give up sooner than one should, right? So, in that circumstance, obviously, when it's not in the mouth, it's not working. So, we have to then look at other alternatives like CPAP. That's again a gold standard treatment. So, we actually
And now
make
the machines are
sound
just,
less.
yeah. And I,
Yeah.
I heard there's portable ones you can take on
Yes.
holidays in the airplane. And they're just, it's so
Gotten a lot
different.
more easier to
Huge,
deal with
huge.
and easier to use as well.
Correct.
So the difference in that mechanism is basically the air is thrown into the
Pushed in,
airway at
yes.
a higher pressure,
Mm-hmm.
and that sort of keeps the airway open. And then there's distribution of oxygen, and you feel a lot better. So again, understanding who your patient is, understanding how severe the situation
If it's
is.
diagnosed or not. So
Yes.
I guess let me take a step back. So if it's not diagnosed, then it's either you go to the sleep lab or there's these machines that we can give patients
Yeah, so
and
you could actually have an in hospital study or an at home study done, and these have to be evaluated by sleep medicine specialists. Just to diversify outside the dental office, it's very beneficial to either see an ENT or a pulmonologist. These patients can further evaluate the airway better, localize where the obstruction is, because some patients might eventually end up needing surgery to sort of, increase
oh,
the
mhm.
dimension of the airway as well. So it's a multifactorial, multi-dimensional disease, and that's why it requires a lot of teamwork to keep it in
Absolutely.
check. And the most important member of the team is actually the patient, because whichever treatment you want to follow with, it requires them to stick to the protocol
Correct.
and to stick to that treatment. So,
Absolutely.
yes.
And what's the biggest advancement in technology that you would say right now has helped us?
So one of them is you can order yourself a home test. That's one. I think you mentioned the smartwatch. It
Yes.
can be a baseline just to be more aware of how you're sleeping. One other thing that I recently read is when we bring the jaw forward with these appliances, there's a physical limitation to how much, and then the other reporting measure is to ask the patient if their symptoms are reducing or reversing, etc. But both could be slightly inaccurate,
True.
because not all days are like, alike, and we could be more tired on some days, less. So
Yes.
there is a remote sensor that can basically shift the jaw forward or backward while the patient is having an episode of apnea or hypopnea, and that titration can be calibrated with this remote sensory device. So that is
Oh,
something pretty.
interesting.
Yeah, I need to research this a little bit more,
Absolutely.
because I haven't read about this before. But I think a
Please do the research
microchip.
and we'll discuss it at
Yes,
another
I
podcast.
think
Yeah.
a microchip anywhere for any kind of information
It's a,
can do
yeah, can
wonders.
do wonders. This has been really enlightening, Dr. Mago. Thank you so much. I know this word sleep apnea is just out there kind of floating about, but it's good to really get to the core of it, know, have the knowledge, not to fear it,
Yes.
face it, and there are solutions as always. That's what's important.
Yeah.
Thank you so much for
My
this.
pleasure. My
And
pleasure.
thank you to all our listeners for listening. And until next time, have a lovely week. Take care.
See you.